Hello and welcome to System Engineering in Healthcare. My name is Jason Airpaul. I'm a professional engineer and economist, and currently I work as a chief architect for iCare Quality. In this brief course, we will discuss how do we apply fundamentals of system engineering to healthcare, and specifically discuss how do we reinvent a nursing care delivery model through applications of system engineering methods. According to Wikipedia, system engineering is a discipline that is often used to develop complex human-made systems. In practice, system engineering methods are often applied from three perspectives: people, process, and technology. And secondly, we look at a specific performance measures of the system, the capability itself, and the resulting outcomes. The system engineering looks at the current state and defines what the target state would be for the capability performance to achieve the required outcomes, and then defines a very pragmatic roadmap that would help transition from current to target state with the minimum disruption to the current operations. Now let's look at the system engineering in steps. Step 1, we understand the goals and the principles and organization's appetite for change. Step 2, we look at what's the current situation. We understand the current situation and the target and the gaps from the people, process, and technology perspective, and most importantly also from the performance measures point of view. Once we understand the gaps, then we can create a transition plan that would help us minimize or close the gaps with the minimum disruption to the current operation. Once a viable transition plan is completed, then we could define a business case that the rest of the organization can commit to. System engineering is not just about creating roadmaps and business cases. It is about executing change. In this phase, we actually undertake the defined roadmap and implement this roadmap according to the business case defined. Resulting transitioned capabilities often take time to stabilize, and getting all stakeholders to learn how to fully leverage them. The biggest challenge in system engineering is not to define step by step what the deliverables are of each step, but understanding that every one of these deliverables are influenced by everything else. So the idea here is, in system engineering, we have to ensure that the system itself is stable enough from all stakeholders' viewpoint, and only once it's stable enough it should be designed and implemented, and that will result that resulting system meets the need of all stakeholders, not only the selected ones. And this is often the biggest challenge, to ensure a balanced system that will meet the needs of all stakeholders. Now let's look at the system engineering application in healthcare, specifically to nursing care delivery model. What we're trying to achieve through the exercise is creating a culture of safety and quality among nursing care providers. What we need is improved nursing care delivery model. We need to know how many nurses are equivalent are we required per patient, and what the skills would look like, and how do they make day-to-day decisions. How does the information flow among teams, committees, and continuous improvement teams? And most importantly, how do nurse sensitive indicators, how do we collect the data? How do we analyze the data? How do we communicate the data back to the nursing care providers, so therefore they can take actions in immediate, not 6 months, 3 months, or 6 weeks down the road? Nurses feel engaged and empowered and satisfied, and we create a culture that supports the magnet vision. Nursing care delivery is not just about determining how many nurses are required per patient. Nursing care delivery model is a lot more than that. It determines how do we achieve a magnet vision, and supporting the nurse as a professional and the leader within the healthcare delivery rhymes. Now what we will do is that if we were to solve this problem through a system engineering methods, I would like to outline a 3-week assignment. How would you go identify where you are, where you need to go, what the roadmap would look like, and what would be the business case, and a business case the rest of the organization can commit to. On day 1 of a system engineering application in nursing care delivery model is to understand the culture from 3 different viewpoints from the top, from the executive branch, from middle management, and also from the frontline care providers. How do we do this? We understand the unit's clinical goals and business goals, and what are the other business strategies and clinical priorities that are going to be impacting. And we understand and review the policies and procedures and practices. And most importantly, we understand from various stakeholders' point of view what will success look like. Day 2 activities are mostly investigational. We understand from various stakeholders' point of view what is going on at the current state, not just from management point of view, from all the stakeholders' point of view. Most importantly, it is up to you, the analyst, to get all the stakeholders to speak to you. Open and free communication between you and the stakeholders is absolutely necessary when it comes to defining organization change management and implementing that change. Common practices for this process are interviews, huddles, observe and follow the process, and both providers and patients. Review charts, review issue logs, and there's a lot of different techniques to determine or identify the current situation. As on day 1 we understood what will success look like, on day 2 we get a reasonable understanding what obstacles would have to be overcome in order to achieve the goal or target, the success that was outlined on day 1. Day 3 and 4 is just a deep dive into understanding what are the impacts, what are the gaps in the people, process, and technology, ensuring that does the information exist at the right place at the right time, what are the performance measures, is the information provided to people in real time, and is the data that is used to compute the measures, is the data is of any value. The techniques for this phase are simply the same: interviews and huddles, observe and follow and chase, and review the current practices and procedures happening on the shop floor. Within the first week, we understand where we are, where we want it to go. Now we look at ADAPT is the most commonly available frameworks in the industry. We look at, review them, and we adapt them to that will suit the current organization's culture and would help the organization achieve the target outcomes with the minimum disruptions to current operations. At the end of the day 5, we have a reasonably well adapted business nursing model that can be reviewed with management. Within the first week, we have a reasonably well understood strawman-like operating model that management can approve. Often week 2 work takes place off-site. During this week, we have a deep understanding, analysis of all the data that is collected from people and process and technology point of view, and understand the current culture and how much change can be accepted. And based on that, we create a transition plan. We create a project plan and program plan. What resources will be required? What will the organization change management would look like? What the technology changes would look like? We end up with a reasonable understanding of what would the transition plan to close the gaps in current nursing care delivery model would look like. Being on-site the third week is essentially the same thing. We identified what are the information gaps, we validate the information gaps, we close those information gaps, then we validate the organization's readiness, we communicate the business case, and we test for receptivity for change. And most importantly, during this week, we build consensus and ownership among those people, those stakeholders that are going to get affected the most. As a result, we are able to communicate the business case and establish a clear understanding among all the stakeholders what the roles are required from them to achieve the transition business case. Business case is formally approved at this stage, and the plan to execute is developed. On day 15, goal is very simple: to define a roadmap and a business case and transition plan that is balanced. That means it meets the needs of all the stakeholders, and the plan is pragmatic enough and executable that ensures It just doesn't become another binder. In most cases, a project of this nature, the challenge is not a technology or the process. It is an organization change management challenge. To execute this change efficiently, you will need a project manager. You need a system engineer, analyst who have supported the roadmap, that we manage each project to the scope, and we build support between clinical, technical, and production support teams. The success of the project is going to depend on integrity of your execution team and support, both visible and non-visible, that they received from the senior management as a part of this project to be executed. Finally, all the projects in transition plan are executed, transition to capabilities are stabilized, and transition to the production support. And the continuous improvement plan and transition to Magnet Vision team or continuous improvement team is handed over. Performance dashboards as defined, both daily and weekly, are being monitored and being followed. At this point, the accountability for results is squarely with the system engineer, analyst, project manager, and a clinical champion who has enabled the execution. After all this work, what exactly have we achieved? We implement nursing care model that fits the culture. New model is achieving both clinical and business goals. A model is balanced among people, process, and technology perspectives. The new nursing care delivery model is now creates a culture of safety and engagement among the frontline care providers, and the model is sustainable. And now it is time to take on the work as formally getting Magnet recognition. What can iCare quality team do for you? We have both system engineers and clinical experts. We help organizations define roadmap and business case. We transition and stabilize the change, and we help develop the continuous improvement plan. Our track record is well over 25 years of experience in various industries, including manufacturing, government, banking and finance, insurance, and most importantly, in healthcare. We want to thank you for your time, and we look forward to hearing from you. Goodbye.